So this week we are looking at healthcare information regulations and laws and standards. Believe it or not, I would try to make this bold statement that nowhere in no other industry it is as much important as it is to understand the laws and regulations and standards as it is in healthcare. I mean, whether you're a provider, as you're a physician or a hospital, you're a doctor, you're a nurse, whether you're a payer, which is an insurance company, Aetna, United Healthcare, what have you, whether you're a pharmacy or whether you're a lab or whether you're even a patient, to understand laws, rules, regulations that are in place to protect you, to make sure that you're following the right procedures to take care of the patient, to take care of the best interests of the patient. There's a lot of rules and regulations and policies in place. So this chapter is kind of an overview, and then the articles related to this chapter, it talks about HIPAA and what it covers, what it not, what are privacy and security issues in healthcare. So it's a good chapter to kind of sort of get all the information in, and not necessarily you remember everything, but you understand the key components of this chapter and the readings that you have for this week. So legal aspects of healthcare information systems. One of the things that's most important, why is this more important, is you're dealing with really highly confidential information. So for example, if you have a health condition and you don't want your employers to know about it, or you're going in for a major promotion, or you are even applying for a new job, and you don't have to reveal that piece of information to your new employer or to your boss who's going to sanction your promotion. You want to keep it confidential. You have that right. Okay. So what are the standards, procedures? What are the bodies? What are the governing institutes involved? Joint Commission is a huge. It's an organization that plays a huge role in setting standards, policies, and regulations in the healthcare sector. Joint Commission, it has 82% of the US hospitals are answerable to the Joint Commission. I mean, if for any hospital, whether it's Christus here in Beaumont or any other hospital, and Joint Commission is a huge deal. I mean, when people from Joint Commission visit the hospital, I mean, literally the CEO, the CIO, all the C-level execs are essentially, I wouldn't say scared, but they know that they gotta be on their top of the game to be able to make sure that Joint Commission people are convinced that they are doing what they're supposed to do in the best interest of the patient and best interest of all stakeholders of that hospital. A lot about Joint Commission, the standards set by Joint Commission. I mean, it's kind of like the overarching body of all the rules, standards, regulations that are set in the context of healthcare. Then you have the National Committee for Quality Assurance, other accrediting bodies like the CARF, or the Commission of Accreditation of Rehabilitation, Association, Ambulatory Healthcare, the patient safety organizations. So what is legal health record? This text gives you an example. And again, talking continuing legal health record, it also includes x-rays, strips, images, what have you, anything that will reveal medical information. So read this, interesting, talks about HIPAA privacy rules, high-tech as an extension or expansion of HIPAA, like we had discussed previous weeks. So lengthy chapter, but very interesting, very informative. Okay, and then you talk about the articles, what HIPAA doesn't cover. Very interesting, short read. Then you have this Deloitte article, Privacy and Security in Healthcare. What does it entail? And then hospital. So this is an example of, for what happens if you breach, and what sort of breach can happen, and what sort of, fines or punishments are out there if you sort of not follow the HIPAA regulations, the standards set by the Joint Commission, and what have you. With that said, this concludes the video for this week. And thank you.